12 years, and I'm self-employed, which means that um, I'm doing my own business, and what I do for a living is basically distribute and sell sporting goods. Um, I'm also a volunteer as an immigration advocate, and I'm just enjoying my experience here and my ride at the Chicago School of Professional Psychology. It's a really good program, and I think it will prepare me and get me equipped for the future. And that's something that I wanted to start off to say. So in saying that, I just want you guys to know that I choose lacking mental health funding in southern states because of the fact that I live in the state of Louisiana, and it's so much corruption, so much mental health, um, so many mentally ill citizens and residents that lives up here, and they don't have the programs to help them, you know, move on with their life so they can get the medication they need, so they can get the help that they need. So a lot of them, you will see if you come down here and visit Louisiana, you'll see a lot of them not only in prisons, but you will see a lot of them pretty much with schizophrenia on the street, screaming, talking to themselves. We have a huge population of people that's suffering from mental illness down here. And, you know, Louisiana has a huge budget shortfall. And we're going to get back into that because some of that definitely is going to be discussed why I'm presenting. So let's get started. I hope you guys are having a good morning, a good afternoon. So the title of my presentation is Lacking Mental Health Funding in Southern States. So we're going to move on to the second slide. And it's an outline. And as you can see for yourself, I'm going to first start with the problems with mental health in southern states. Secondly, I'm going to do the amount funded to mental health programs. The third one is programs being neglected in or not receiving benefits. And then we have like the patient suffering. What are the patients going through by their states not having adequate mental health facilities and adequate treatment for them? So I think that's something that's probably touching all our hearts right now, that we want to see our people do better. We want to see them have the correct psychiatrists or the correct social workers or the correct medical treatment that they need so they can become healthy and better. And then we're going to do what's being done. And my recommendations, and I'm going to have like a short slide for questions and then references. I just want you guys to know that if this run right into an hour, please just feel free to email me, or at the bottom of the chat button, just place your questions there. And if it's something that you really want to know the answers to, let me know. And I'm definitely, within 24 hours, I will definitely have those answers for you. And it will be my pleasure to do the research and provide you with those answers to your questions. Even if I don't have them now, I'll definitely have them in a short period of time. Okay, so our next slide is it's gonna be a continue. I think I have like 4 slides just talking about the problems with mental health and in southern states. So from doing a little research, and it's always good to do that, doing a little research, states with the highest prevalence of mental health and the lowest, I have this thing under here. Okay, could you guys still see the screen? Could you guys see the screen? Yes?
You might want to hit your slideshow button. It'll make your slide bigger.
Okay.
Up at the top, see where it says slideshow?
Okay, I see it. I had like an icon over it.
And then go from current slide.
Okay. Thank you.
You're welcome. There you go. Should pop up on your whole slide. There you go.
Okay, so this slide is just basically talking about the problems. You're welcome. The problems with mental health in southern states. And the states with the highest prevalence of mental health and the lowest rates of access to health care is Mississippi, Louisiana, and Arkansas. And when I saw that, because when comparing to other southern states, some of them have implemented other programs. And what I mean by that is that they have found a way where they can actually keep their mental health programs within existence. They have not really added too much as far as their budget has not increased, but they have found a way to keep what they have in mental health in mental health for their clients or for their residents without having like substantial budget cuts. But when I noticed that these three states, and that's why I decided to talk about them, at least for this slide, that they had to do a lot of budget cuts. And we're going to get into that a little bit more because basically, as I stated earlier, it's because that these states is in a lot of debt, and it's not only the mental health that they're cutting, it's also education. So we're going to, move along. I'm going to touch briefly on that in a slide that's coming soon. So the other things is the highest percent of uninsured adults. Now, I put the note at the bottom so you guys can know it changed when Obamacare came into place because more people were able to get insured, but it still have people that's working poor. And what that really means is that they're not able to get into a lot of programs in Obamacare because you're supposed to be making a certain amount. So they still fall back on Medicaid or being uninsured. So some of these things still apply to our current situation with residents that's living in southern states. So everything is not invalid. Like this information still exists because a lot of people are still uninsured. So the highest percent of uninsured adults and mental illness are in southern and western states. Um, 7 of the lowest rankings are 10 states where children is least likely to obtain needed treatment are in the South. Okay, so you got to understand by Louisiana and other southern states, Mississippi, Arkansas, by them cutting, having budget cuts, what's really going on is that, those little programs we have in school for behavioral health and different things the school may offer the children that's outside of pediatric care or outside of the primary care position. Well, these states are trying to leave those responsibilities up to the pediatricians and up to the adult primary care physicians. So that is like, that's what these budget shortfalls are doing. It's cutting programs that our children and our residents are in dire need of. So that's a big problem, and that's something that we're going to have to work on as a whole. But let's keep moving along. I want to touch on all of these things. So, problems with mental health in southern states. We're going to do Louisiana, major problems, and that MH is mental health. So it don't mean Medicare and hospitals or anything like that. It's just mental health. So I put like the MH so I can kind of like, save space on the slide. At the bottom, what you would notice what I done at the bottom, I think that sometimes we have references that sometimes we don't know exactly where it's coming from. I just put the source so you can know exactly where this information is coming from if you guys would like to go back and view it. So I put the source right under it. So let's start off with Louisiana. And basically, this is slide 5. So basically with Louisiana, we have more than 4 million people that's right here in Louisiana. And these 4 million people are not just the population. No, that's people that's actually suffering from some type of mental illness. They're struggling with it. They're suffering from it. And we have 2 major causes that I guess most psychologists see that their patients are suffering from is pretty much two disorders: is acute trauma and chronic genetic disorder. And when I was reading Advocate 2013, it let us know that our governor, this is referring to Louisiana, our governor, Bobby Jindal, is pretty much, you know, he was launching a committee on school safety, and they want to, cut programs with children behavioral health. This is what I was getting into, and that's why I didn't finish it earlier. Um, they want to pretty much in Louisiana, they want to put all the mental health problems on your pediatrician. So, for instance, if your child's acting out or your child's suffering from trauma, that will be something the pediatrician would have to deal with, which the pediatrician is not qualified or not educated in mental health. He would have to take that upon himself to try to help the child. So they're trying to keep everything I would say they're trying to keep everything with one doctor. I guess they think that's a way to save money, but the child is actually not being treated. But that's what they're doing down here in Louisiana. So what they want to do is they want to train. They want to put a training though. I think this might help somewhat, but I don't think it would have adequate results. They want to provide training to those pediatricians and those PCPs on mental health. So I guess that's their way of a child or an adult being treated. Or we're just supplying with some training and give the PCP or the pediatrician power to give the child medications, and it should be fine from there. So that's what they're doing down here. The problem is that by Louisiana being being below poverty line, it still is no insurance, and no insurance means you can't see the doctor. And if you're living below poverty line, how could you even go to a doctor on a sliding scale fee? Because you can't afford that either. If you just have enough for rent, for food, and for utilities half of the time, you definitely can't go see a doctor because you can't afford to even pay those sliding fee scales. I mean those sliding fee based on the scale of income. So you a lot of times you just gotta miss out on just not seeing a doctor. Um, Basically, those fields are generally overloaded, and Louisiana, the hospitals, so the hospital stays are usually short in Louisiana. That means that they're not going to keep you longer than the average 3 days. If you came in there with a problem of depression, you're going to leave out with the problem of depression. They're not going to let you stay no longer than that. And then the slide side is Mississippi. Mississippi is just like they're taking steps to providing care with the community, but they still cut 10% of the mental health funds. They did that between the budget between 2009 and 2012. The report finds that Mississippi psychiatric hospitals are filled to capacity, so note and service are not available to people. So if you have a severe crisis, pretty much, you're not going to get seen. They do better just putting you in a correction facility. I think that's going on throughout the U.S., but that's where Mississippi stands with that. But they are letting you know that they cut their budget for mental health by 10%. And for Arkansas, pretty much Arkansas have a small number. It's really a small number um, of people that they give mental health services to. Pretty much it's usually veterans, or they take care of their children a little bit better than the other southern states. They'll make sure that the children are taken care of, and they'll make sure that the veterans are taken care of. But basically, if you're homeless or you're an adult without insurance, you pretty much don't get or receive a treatment like you would if you were a veteran or a child. They say this is what they quoted. They say anyone who wants real care or mental care, they need to go to another city. and that drive is usually 30 minutes to an hour away. So they're letting you know if they can't treat you or if they don't have the funding to treat you, you need to go to the next area. So that's what they're doing down there in Arkansas. So the next slide is amount funded to mental health programs. And this came up, I guess, by itself. Um, as you can read here, this is the National Institute of Mental Health, and it estimates the total cost associated with mental illness is roughly around $300 billion a year. And this is based off 2002 data. So in saying that, I have some more information about funding for mental health. And basically, they say in the last 5 years, and this is for southern states, okay? They say in the last 5 years, significant budget cuts have fallen in mental health programs and services. From 2009 to 2011, states cut the budget by $4 billion. The single combined reduction to mental health since the combined reduction to mental health since the 1970s, faced with 1.6 billion budget cut shortfall and willing to raise any taxes. So the governor, he wanted to slash spending for already struggling states. He wanted to still slash. And Louisiana Hospital, by them slashing it, they're in the hole of $142 million to service their patients, their clients. They're in a hole of $142 million to service the mental health problem that's going on here just in Louisiana alone. So that's something that we don't want to have to experience as a people, but that's what's going on now. You know, like I said earlier, the poor is usually the one that's going through everything, the people without insurance, and the children that's at the schools that their parents not be able to provide them with any kind of private schooling or practice or anything like that. They're the one that's really suffering. So Jindal, which is Louisiana governor, budget cuts funded the mental health and hospitals by nearly $15 million. So in addition to that, $142 million, he's trying to cut an additional $15 million on top of that. That's what our fantastic governor is doing to the state of Louisiana. Sarcasm, you know. So despite the need to balance the budget and to make all care more efficient, many argue that society has long-term outcomes, such as there are going to be state dollars are allotted to mental health and health services. This includes preventive services as well as mental health testing and treatment. So that's the programs that's going to suffer more, like behavioral service and mental health, any kind of mental health services that have anything to do with trauma. That's what's going to suffer more in these states. So we're right here on mental health funding. And this is just right here. This is like the expenditures for the different states. And this goes by the millions. This is what each state, this is the period that reflects spending in each state. So this is what each state is spending, vice versa, what is needed. And this is based on millions. I have the link right here because actually, if you go to this site and you click up the link, they'll actually give you the information on how much mental health costs is for the average person. The average person with mental health. If you click on the state, it will let you know. I just put the whole map on there. I didn't try to cut through just for the southern states. Like you can click on each one of these links and they'll let you know how much care is that each person needs in the state of Louisiana, Texas, or Florida, or whatever. So I think that's very important for you guys. If you guys are interested in that, I found it interesting. I found it educational, but you know, the link is there so you guys can click on it and find out that information. Basically, because individuals untreated with mental health illness often find themselves in emergency rooms, homeless shelters, prisons, and societies pay for these treatments. And the thing about it is that I believe that more money is being wasted when you let them go. I don't think they're actually saving money, because when you let them go to the emergency room, when you let them go into prisons and different things, it's a cost to keep them there. I think that it would be better if you just provide them with the services than still having to feed them, take care of them, let them have access to certain medical treatments, than to just treat them, get them stable, and be able to be productive in society if they can, if their mental illness, could be controlled or contained. So that's how I feel about that situation on mental health. And you put them in prison systems and emergency rooms. It's so much money for a patient to walk into an emergency room, vice versa, have a PCP, a mental health PCP, where they can go to scheduled appointments and get treated directly. We all know that we go to the emergency room, you're not being treated. They see you, they might find something that's wrong with you. They don't have to specifically be that, and they kind of send you your way. They don't keep you long, you never really get it treated, and it's not a clinic, so it's not ongoing services. So the next slide I'm talking about is programs being neglected, and we talked a little bit about that. But the programs that's being neglected here, I just have it laid out here. It's basically access to mental health services, children mental health services, suicide prevention programs, homeless outreach programs, substance abuse treatment. Pretty much anything that have anything to do with mental health is being neglected in these states. It's not only being neglected, they're not really doing anything to bring these services back. So we're losing them every year with a budget shortfall. So we're just saying that the mental health situation in these southern states are becoming worse. So that's just a fact. That's just something that we are just living with right now. Things are not becoming better. It's becoming worse. And they're constantly cutting the programs, not only in the clinics, in the hospitals, but in the schools. So we really don't have too much that we're living off for mental health. We're starting to see, especially in Louisiana, I'm speaking more about Louisiana because I'm from here. We're starting to see large cases of people with HIV/AIDS dying because of the fact that there's no treatment for them. A lot of people, and you know something else I wanted to bring up, and I wanted to bring this up earlier. I wanted to bring up the stigma. Another thing, when they do have these scarce sources available, I would have to say that mental health is often viewed as a curse. I think that they view it as a curse. They make you feel shamed. Society makes you feel shamed if you have something that is not identifiable to them. If it's a difference, you should. Well, that's an embarrassment. Oh my God, look at this person talking to themselves. Oh, look at this person with AIDS. They caused this on themselves. Look at this person. This roughing this person. This person, they're contaminated. Look at this person acting out with this kind of behavior. They're crazy. You know, you have so much backlash from not, I guess, per se being normal, whatever that's supposed to mean, for being normal, of not being what I guess your ideal normal person is in society. So I think that also might play a role in why we might have certain people, not all people, because we already talked about the budget shortfall, and we already talked about how programs are being cut, but I think that's something we should add to why there's such high mental health untreated mental health clients or patients, because of the embarrassment, the stigma that's attached to it of not being normal. You know, you're crazy. You know, you're diseased. Something's not right with you. Why would you do that? So I guess that's another reason why it's the way it is. And then the next thing we want to talk about is the next thing we want to talk about is the patient suffering. And I know that we all probably, I don't know if everyone have someone in their family that's suffering with a mental illness, or a friend or relative, but it's painful to see someone you love that's not able to really help themselves, or not able to function in society. Um, when the states and when the government cut these programs, the people suffer. The people really don't have any hope. Like, you lose your hope. The family watch their family members go down. They watch them not able to, no life is in them. They watch them not able to grow. They not watch them not able to live life. Financially, the family suffers, selling things, doing everything possible to make a life for their family members. I think the family and the community suffer more than anybody else. The community have these people living there, and the family suffer by not seeing their family members grow. And I have some information about that. It's not um, too much research. It's not too much research, but like I said, if you look through these slides, it always have a source under it. So you can pretty much look up this information yourself and see that, you know, that is valid, and and look through it and work through it if you have to. If it's something that interests you, then you can go back and look at it again. So they say, according to the National Alliance of Mental Illness, increasingly emergency rooms, homeless shelter, and jails. We already talked about that is suffering, but it's not only doing that. They leave. They're the effects of people falling through the cracks due to the lack of needed mental health services and supports. They're falling through the cracks, you people. They're falling through the cracks. They're not making it. They're not able to live the life that they should be living, the life that we're living, the life that we're able to live. They're not able to do that without efficient care. So the cycle they usually go through without this care is their whole life, they just go in and out the system, and they never really receive the treatment. They just go in and out the system. They treat it as something that is not. These people just go in and out the system, never really finding out what's wrong with them, never really finding out what's the problem. They just go in and out, just go in and out the system. So that's something that, I felt that definitely should be mentioned. It definitely should. I have family members that suffer from bipolar. I have family members that suffer from different mental health illnesses and diseases, and it is painful if you watch them not being able to be the best they can be, or not able to move out of the rut that they're in. So I think that's very important, that we should definitely, that our governors, our states, write petitions, do whatever we have to do to help with this, major problem. Like I said, if you come down here to Louisiana, it's really bad down here. It's really bad. I think half of the stuff that we see people do down here and we laugh about it, it's because they're mentally ill. I think things become funny when we don't have to deal with them. I think it's always a joke when it's another person that's struggling, or another person that's going through something. I think it's funnier when we don't have to deal with it. I think that's when it becomes a joke, or something to laugh at, or something to ignore, because it's not actually affecting anyone in our family, or anyone that we love. So we kind of ignore things. Oh, well, they had to cut something. It had to be mental health, because you think like that because you don't have nobody that's close to you that's actually pulling on your heartstrings to cause you this to be an issue for you. So the next slide is what's being done, and this is probably my favorite slide on what's being done, because I put this here because I like the point that Alabama is trying. I mean, you cannot knock someone from trying. So in this research, they're just saying that they're putting a small budget, not some millions, about I think it was like $10 million in the state of Alabama, that in Alabama, Mississippi, they're doing it in these two states. So they're training deputies for first aid program for mental illness. Since I think it's a great idea, because the whole thing about it, where is the mentally ill? In jails and prisons. So I think they should have this education presented to them where they're able to handle these people, because you got to understand, there's a difference between being a criminal and knowing what you're doing and actually wanting to do that, but it's a whole nother different level in story where you're acting out of a behavioral problem or from a mental illness, because I believe that it's not the same. I think one is deliberately done and one is done because you're not being, you don't have the treatment to stop those impulses and those urges to do what you do. So yes, I look at it different. I think it's important that Alabama and other certain, I believe other certain southern states should adapt to this. Like they should provide their deputies with mental health training so that they can be able to treat the mentally ill differently from how they treat the other prisoners in a correctional system. So that was like my favorite part of research, knowing that it had something being done about it. So, you know, if there's an issue, you definitely want something to be done about it. The next one is probably like just recommendations, and recommendations is like what I think needs to be done. And I'm gonna, cause you know, I didn't find too much research, and it said, but no, I didn't find a lot of research of too much that's being done. Like I said, most states are pretty much just doing what they need to gather the information. That's what most states are doing. They're doing what they need to gather the information. I mean, to keep mental health. They're not trying to promote other programs. They're not trying to increase their budget. They're just maintaining, pretty much. Are we going to just keep what we have? We don't have the money to increase anything or to add anything, so we'll just keep it flowing steady, helping the minimum people we can help. But I just had some things in mind. So the recommendations, I thought that the one that was done at the University of Chicago Crime Lab, as far as providing therapy, some programs like this to curb youth violence, especially among those with behavior and mental care needs. I thought that was important. I have some other things I think would be very important. So in saying that, we have to get the community involved. From prior, I know in other countries they definitely do this internationally, but what's wrong with training members of your community in order to deal with mental health? Because it's going on within the community. I don't really think, I think if you come into a program, it's like a volunteer service, like, because that's what most of the time we're doing when we're trying to do internships. Most of the time they're not paid for, and we have someone over, they're training everyone else, they're teaching them how to deal with different sickness and illnesses and different ways, different interventions and stuff to use. So why we can't do something similar to like laypersons, like, you know, train people in the community, get them out into the community, and kind of like help aid people with mental health. I think that can help through the budget shortfall, because actually we don't have enough money to pay them. So it can be used as something you can put like volunteer services for people that's looking for experience from mental health or trauma services. So that's one way. Get the state involved. Let them see the dire needs. I'm pretty sure that, you know, every year when they do their budget, they have things that they cut and things that they keep. Well, let's see if the things that you're making sure that aid is being provided towards is actually something that the people need. What are you putting your money towards? Is it helping the community? Is it helping the people? Evidently, you're in office because of us. We vote you in so that our needs can be served. Our community is not served. Nothing is being done. So we definitely need to come together as a people and talk to the government, the states, make laws. And this is another one I found. They say in primary care physicians are involved, train them for preventative services for mental health. If you're going to involve them PCPs, you might as well do preventative services or train them like you're doing the deputies. They need training. So I think that's important. They said, according to the Community Preventative Services Task Force 2015, recommends that mental health benefits, particularly comprehensive um, legislation based on significant evidence of effectiveness in improving financial protection and increasing appropriate mental health services for people with mental health conditions. There is also evidence that mental health benefits is associated with increased cost to care, is associated with increased access to care, increased diagnosis of mental care conditions, reduced prevalence of poor mental health, and reduced suicide rates. So why not make this like a law? Why we can't have where, you know, how we place laws for everything else? Why we can't just make it into a law that the mental health has to be treated? Why we can't just, you know, make that into the law as far as placing the law? Okay, well, mental health must be treated because A, B, and C. I think we're wasting more money keeping them in a position they are. Other resources are being drained. I think that the budget cuts are done unfairly and it's done unjustly. I the doctors, that's money. That's a lot of money. So the money is actually still going out, but in another direction, but it's still being used. So um, shoot me your questions. What questions do you have? Anything that you feel like I should have added, I should have took away? Anything that you feel like you wanted to hear that you didn't hear? Shoot me your questions. Let me know um, your opinions or your questions about the presentation. And like I said, if it's something that I do not know within 24 hours, I would definitely do that research for you and have a response for you. So any questions, anyone? Hello? Any questions?
Yeah, I don't have any questions. Thank you so much for the presentation.
Thank you. I appreciate talking to you guys. It's always a good experience. So I thank Erin and Ashley Ray and Leona. Oh, wait. Leona, have a question.
And you have Jessica.
Jessica, I'm trying to see all my, I thank everyone for coming. Um, I thank Erin, Ashley, Leona. Yes, she came. Um, okay, Leona, California, Senator Steinberg Road, Prop 6th Street. Do you have any advocates in your area? I don't know that question, but I'm about to do research for you. So I would definitely, could you send your email? Could you hear me? Could you put your email under so I can send you the answer to that? I don't have the answer right now, but I'll definitely do research and give it to you. Prop 36 has provided 13 million of mental. Oh, I mean, I'm pretty sure you guys have things that's going. I haven't really researched Western states. This was on Southern states. I just know that our funding is being decreased. It's being cut. So maybe I'll look into Prop 63 and see what is going down here in the South. Through all my research, I did not see anything about Prop 63. And they're giving us anything. Okay, okay. That sounds like a good idea, Leona. Yes, I think that would be a good idea. I recommend that. Thank you. That's good information. Let me copy this so I can know. Anything else? Thank you. I appreciate talking to you guys. I thank each and every one of you for showing up. It's greatly appreciated. It's helping me get my. Okay, thank you, Erin. I appreciate you guys. Thank you, Ashley. Okay, thank you. I appreciate you guys so much. Okay, Leona, I'm about to place your information in my email, and so I can be able to respond back to you. Thank you, Jessica. Okay, Prop 63. Okay. Thank you, Leona. I got all your questions. I'll be giving you a email probably by tomorrow. Thank you. Okay, Ashley, I'm leaving. You still there?